Hello guys. Hey, you're welcome back once again to my YouTube channel, Dr. Kunle YouTube channel. It's your boy Dr. K, and I want to appreciate you guys for the support so far. I mean, it's been overwhelming and I really appreciate. We are up to 1,430. Wow, such a short time, and I really appreciate it. There is none of it that's going to be possible without you guys, without your support, and this means a lot to me. I've done a lot of videos, and I see the way you guys support me. You help me share the videos, and I promise you, we are getting there. Little by little, we are getting there. And today's topic is going to be a bit of a table shaker. I need you to stick around till the end of the video to get details of everything I want to talk about, because it's a very sensitive topic. It's a topic that people usually have different thoughts about it. The topic is low back pain. I've had, when I put it on my WhatsApp status, I had a couple of people tell me, well, not like a lot of people came and said, oh, I have this problem, I have this problem, I have this problem, I have low back pain. And I'm like, okay, you know what? Hold on till the end of before the end of today. I'll drop a video. I'll try to break it down, different things like that. What the causes are, what can be done to help it or treat it, and how to prevent it. I think those are like the key areas. What is causing your back pain? What can you do to your back pain so that it will go and not come back? And then last part will be how can you prevent it from even ever coming, or when it goes, so that it doesn't come back. Low back pain, and I think it's a very, very important topic to trash in this time. It's very important because everybody has it. So at some point you have it. The part of the lower back that we are talking about is called the lumbar part. The lumbar part it comprises of 5 bones. We call them vertebrae. 5 vertebrae just below the rib cage area down, the 5 of them. And this area is the place that carries all the weight of the upper body. All the upper body weight is on that lower back region. That's why it's prone to injury. That's why it's prone to stress itself, in the form of the low back pain that we are talking about. So low back pain can range from dull, constant pain, it can just be there, pain that is just continuous, and it can also be sharp. It can be sharp, it can be acute, it can be chronic. Some people have low back pain within 3-4 weeks, it's gone when they take medication. But some people have been having low back pain for the longest time. Those people are the chronic people. They have chronic low back pain. So that's what we categorize them as, chronic low back pain. So, as I said earlier, there are 2 types. There's a acute type, which is about 6 weeks, and there's a chronic type, And also, we can also categorize this pain due to the problems that bring them. We can say like a mechanical problem. Mechanical problem will mean things like muscle strain, the ligament sprain, or problem with the disc. That's the disc in between the vertebrae themselves. Some people have what we call slip disc. Some people have what we call disc herniation. Some people have what we call disc degeneration. Those are the terms you see when you do an X-ray or an MRI or a CT scan on that area. These are the terms you tend to hear. And so these are what we call like mechanical causes of mechanical types of low back pain. Of course, one of the most common causes of low back pain, is prolonged sitting. During my clinical practice years, I experienced so many patients who came in with low back pain, and one thing they usually have in common is prolonged sitting hours. These are people who work in offices, people who work in office and sit down for long hours. Long hours can, and without having the privilege to stand up, then you can be sure that those kind of people come in with low back pain. Also, as I said, poor sitting position, poor lifting positions. If you want to lift something and you lift it poorly. When we get to prevention, we'll talk about how to lift something properly and how to what to do. Let me just put it out here. So, I mean, if you want to, if you need to sit down for long hours in the office, we recommend that you sit. If you sit for an hour, you should stand up and take like a 10-minute stroll. Just take a 10 minutes walk around. And if you are trying to lift an heavy object, let the weight be on your knee. How do you do that? You squat and lift it like that. You don't bend over to lift it. There are some trainings in weightlifting that those ones are on another level. This level we are, that's what we do. You put the weight on your knee before you lift any object, and then don't bend over to try to jab up an object. So that's the mechanical. Although also there are some medical causes to low back pain. People that have arthritis, they have low back pain. People that have what we call osteoporosis, when the bone is not as strong as it's supposed to be, starts breaking down. Yes, they can also have low back pain. And also low back pain can also arise from other parts of the body, like people who have some problems with their kidney, maybe kidney stones, maybe kidney infection. Yeah, they can present with low back pain. So those are like the common causes here and there that can make you experience low back pain. So it's important that when you have back pain, you should try and get to the hospital. From the hospital, the doctor will be able to examine properly, ask you a lot of helpful questions that will allow the doctor get into what next to do. So now, there's a low back pain. What next is to be done? How do we diagnose low back pain? That's it. How do we diagnose low back pain? When you go into the hospital and you see a doctor, you explain what's wrong with the doctor. The doctor has a lot of things he could be thinking in his head. So the doctor can say, okay, let's do an x-ray, which is like the commonest x-ray of the lumbar region, which is like the commonest to do an x-ray. We can do like an MRI. If you think the problem might transcend what's, your problem can be with the bone. I think I have mentioned the problem can be with the bone, problem can be with the nerve, problem can be with the disc, problem can be from the internal organs, from what I've said earlier. So depending on what the doctor is thinking, it might say you should do an x-ray, or it might say you should do an MRI, it might say you should do a CT scan or an ultrasound scan, depending, because if you have pyelonephritis, that's like infection of the kidney or the kidney coverings, the doctor would probably, after examining, would say, okay, let's do an MRI, or rather an ultrasound scan of the kidney to see what is important. And that's the type of test the doctor will ask you to do is almost usually relevant to the severity of the condition. And then the doctor will also, of course, tell you what and what to do. So what are the treatments? How do you treat a low back pain? This place is very touchy. Over the years, having met so many patients, I've seen people who have gone to different lengths to take care of low back pain. One, people have used what we call ashakbo. These are drugs that you get from local drug dispensaries that consist of various types of painkillers. The person will now use all the painkillers, then the pain goes. This particularly is very dangerous for the internal organs, the kidney and the liver alike, because these drugs are painkillers of different types and with different mechanisms of action. Dosing yourself, and it can cause a lot of damage for people who do that. That should stop. I've also seen people going to use herbs. They call it different names. In Yoruba, they say agbojedi. Even though I've not seen anybody that has been able to give me the correct definition of that jedi. There's agbojedi, there's ashakbo, and there's opain. Okpai, is that lumbar part of the back we are describing, say, giving you okpai. I mean, so I've seen people use a lot of different things for low back pain, so, and I'm here to tell you, sorry if I'm going to burst your bubble, that none of those things work, or none of those things is the right thing. Let's start from there. Is the right thing. The first best thing I recommend for low back pain is rest and lifestyle modification. Some people's low back pain is from the muscle of that back, we call it lumbago. The muscle of that part is stiffened. When there is a stiffening, the person just needs to rest, maybe adequate sleep, or maybe good lying down on a proper bed. Some people need to start doing some level of sitting modification. Some people need to get a backrest for their chair. Some people need to change their chair altogether. I mean, so this is the first thing I would recommend for people who have low back pain. You just first sleep well and modify your activity. Then also stretching exercises. Stretching exercises also work really well when it comes to low back pain. So we encourage people to also try some stretching exercises, here and there for low back pain. Also, what usually works too is medication. Well, I mentioned some medications earlier, but those medications are not meant to be taken together. No. If you are sticking with paracetamol, use only paracetamol. If you are sticking with ibuprofen or diclofenac, use only those ones. Any other medication you need to add to these ones must be recommended by your doctor. Must be recommended by your doctor. It's very important. Also, exercise plays a very huge role also in taking care of the lower back region. That's another thing. Exercises. Some people are not so active, so they get there to develop some muscle weakness and all that. Then when it comes to the bone, there's one part of medicine called physiotherapy, physical therapy. I know a lot of people have been recommended to get physiotherapy done. I mean, a lot of people came to my DM to explain to me after I put out that post on my WhatsApp, that, oh, doctor, go to physiotherapy, this and that. I know one thing that is important for you to know is that physiotherapy is done in sessions. You can't have one session of physiotherapy and you think that is the whole thing. No, physiotherapy is done in sessions and it is continuous. Physiotherapy sessions are continuous sessions. They can tell you have 6 sessions at once. After that 6 sessions, you need to go back, to assess yourself and see if you need more or you don't need anymore. So I mean, some people do 6 sessions and they think that's it. So, doctor, I've done 6 sessions of physiotherapy. I didn't see any result. Now, 6 sessions, that's one cycle also might not be enough. Some people also use hot and cold therapy. They use ice blocks. Some people use warm water to mop the back. Yeah, well, not as much as that's okay. It doesn't work all the time. It works only in acute phases. If it's just starting, if this pain just started yesterday or started day before yesterday or started in the first 1 week, yeah, you can quickly use some hot water or cold water or ice block or ice to apply on that area. That could work in some people, or some people it doesn't really do much actually. Then another thing that I see people do is chiropractic. Chiropractic is actually good. Some form of massage therapy is also good, for people who know how to do it. For people who know how to do it, that's the key word, people who know how to do it. I've seen some videos where, I've seen some people, not even videos, I've seen some people who have employed their children to come and step on their back. Some people ask their spouse, let me step on this side, this particular side. Yes, this side, that's where the pain is. Let me step on it. Some people do that, But I mean, all these things really don't work. They really don't work because the person is not doing the right thing the right way. So people who go for chiropractic, people who go for massages also help. There's also this practice in chiropractic. They call it the ring dinger, where they stretch the neck of the patient and the person feels the pain all to the lower back. Well, question marks about the ring dinger, question marks. I'm not a chiropractor, I'm not an expert, but question marks because some of my orthopedic colleagues disagree strongly with it. But you know, I usually say something before you start to engage yourself in many unconventional ways of treating yourself. Make sure you speak to a doctor first. Make sure you speak to a doctor first. So the last type of treatment that you can get for lower back is surgery. You know, I used to know a particular doctor, you know, at some point, young, well, I didn't know when he was young, but I mean, he was still young. He was in his early 50s when I knew him. And in his early years, he used to do everything himself. Take patients to the theater, to complete the surgery, put the patient on the trolley, wheel the patient into the theater. You know, he does things mainly by himself. And after a while, he started developing low back pain. MRI came and said there was spondylosis, like and some disc degeneration in the lower back. It means his lower back has been weakened by the activities he has done. You know, and if you look at it that way, he had to have surgery done to put plates that will straighten the back, you know, as a doctor. And then I just want to extrapolate that information to put in our everyday life as me and you who do hard labor. You have to lift things every day. You know, you have to push things every day. You have to sit down for long every day. These things have an effect on the body. You know, these things have an effect on the lower back. And I have seen many patients who, through hard work in their early years, have subjected themselves to hard labor so much that their backs is now giving them a lot of problem. You know, these people will have to undergo surgery. You know, I know a lot of them. You know, I know a lot of them, and you know, nobody wants to do surgery. No surgeon is happy to take you to surgery, except that is the last and only option that he has. Trust me, you know, because surgery has its own risk. You know, and I mean, nobody really wants to get there. So the best thing to do is prevention. So how do you prevent low back pain? First thing to prevent low back pain is to get a good chair. Get a good chair to sit down on in your office, you know, so that if you have to inevitably sit for long hours, then you are doing your back a favor. You're not doing danger or harming your back. There's the ergonomic chairs that have a curvature. That curvature sits into the lower part of your back and gives you that relief when you sit in those chairs. Number two is also exercises. You know, it's good to do exercises. Some people try to do yoga. Some people try to do some running. Some people try to do some calisthenics in the house. That's okay. Exercise will also definitely help you with any form of lower back. In fact, I used to have one lower back pain. You know, it's like some weeks back. And I remember, I remember when I go to the gym and I do some running in the gym, the pain just goes, and I'm fine. You know? So it's very important. Low back pain has to do with a lot of exercises. Also, maintaining a healthy weight. I mean, I can't say this enough. You know, maintain a healthy weight, because if you see people who are obese people usually have problems with their lower back, because their lower back region is carrying the whole weight of their upper body and is bearing down on it and causing a lot of pain. So people who are obese usually have lower back pain. So as I said, adjust your lifestyle. You know, adjust your lifestyle, adjust your posture. You know, don't add too much weight. I mean, just, you know, your chair and so on is very important. If you feel that you have problems with your lower back and you haven't found enough cure, or what the drugs you are using or the therapy you are on presently is not giving you enough relief, you can come to the comment section and let's have a chat. You know, let's see if there are some things we can really add to what you're taking and see how we can help you going forward. If you have found this video useful, make sure you subscribe, like, put down a comment, share with people you think have the same problem, and I'll see you in my next video. Thank you. Bye for now. I love you all.